All right, so let's get down to the crux of the matter. Why is everybody upset about this? Why is everybody screaming about this? Not just here in Arizona, but across the country, talking about it in terms of prisons, talking about it in terms of county jails. Why does it matter? Why does it matter to John Q. Public and Jane Q. Public out there? Why do we care about what goes on in these prisons? A lot of people subscribe to the belief that you got what you got coming because you broke the law. And that's a whole separate argument that we could dissect about that and about what it means to be an American and live under the Constitution. But that's not the purpose right now. Let's just look at what it means to a family on the streets in one of these small towns, rural areas, or in the big city, in the big urban areas. So what you have in front of you is the COVID-19 prevention protocol, right? So what they say is to wash hands, use soap, avoid crowds, 6-foot distancing, wear masks, avoid handshakes, and disinfect surfaces, because COVID-19 lives on surfaces for a considerable amount of time, which oxygen usually kills a lot of these type of viruses and stuff, but not COVID-19. There's other ones it doesn't as well, but it's a persistent and resilient virus, and it's an airborne virus, and so it's not only carried person to person, but it's airborne and it stays on surfaces. So this is what is the concern. And so when you look at this, let's go through each one of these. Wash your hands. They say wash your hands constantly, and you're going to want to use antibacterial soap. Well, as we've discussed in a previous video, that's not so easy for a person in prison because A, the Department of Corrections doesn't give you soap. We've debunked that fallacy before, and a lot of people were shocked to find out that the Department of Corrections does not provide inmate soap. And so the Department of Corrections actually came out and said, oh, we're going to give them soap. But what they've given them is these little tiny hotel bar soaps that are not, they're just regular little, what you get, the cheapest stuff that you can buy, 15 cents at the store. And that's what they've supplied. And they haven't even been consistent across the state about supplying that to inmates. That's a big issue that we've addressed in some of the surveys that have been done, and information that's actually coming from the inmates on the inside is the infrequency and inconsistency in that rollout of the soap. So, washing hands is pretty much out. Using soap that kills those germs is out, rare, and difficult. Now that all the work crews have stopped, those guys in there don't have any source of income unless it's coming from family. And since everybody out here is laid off or off work or whatever, that becomes extremely difficult. So not only is there no money on the inside being earned, but there's no money out here being earned as well. Avoid crowds. Well, we just showed you that they can't avoid crowds. You can't avoid crowds as an inmate or avoid crowds as a staff member going into these crowded places. So that's an enormous problem, especially when we're talking about the runs that I just showed you, the dorms that I just showed you, the Quonset huts that I showed you, the tents that I showed you. The majority of inmates in the Arizona Department of Corrections across multiple custody levels live in crowded conditions. They're right on top of each other. They do not have the ability to go 6 feet from each other. Moreover, they are being locked down. They're being not taken out to work crews and all that kind of stuff, which is necessary. So they're in this space, breathing on each other, next to each other, 24 hours a day, 7 days a week in this tiny little space. So avoiding crowds is absolutely not possible. Next, talk about wearing a mask. Well, you can't, as an inmate, you cannot wear a mask in the Arizona Department of Corrections for any number of security reasons. So that's out. Inmates are not allowed to wear masks there. This was a big thing to do with the staff members getting masks. And there was a huge thing, which I'll show you here in a second, between the staff being told that they specifically could not wear masks in the Arizona Department of Corrections or other PPE because it would scare the inmates, which was just the most ridiculous thing in the world. And that came from Director Shin. The union leader and the Arizona Guard Union, I'm sorry, I'm misquoting their name, but that union actually, in something which was should shock the conscience of everybody in the state of Arizona, literally called for the takeover of the Arizona Department of Corrections and said that stop following the director's orders, that you are to specifically disobey the director of the Department of Corrections as an officer and put on PPE. And if they tell you you cannot do it, then you're to leave and go home and file an IR, which is called an incident report. I will play that video here in a moment. That, again, should shock the conscience of every man, woman, and child in the state of Arizona. That is a complete usurpation of the power of the director of the Department of Corrections, and that was coming from internal. So this isn't just inmates complaining. This was staff members complaining. But even after the director acquiesced and authorized masks, what we're hearing from people on the inside, both staff and inmates alike, is that many of the staff are not electing to wear masks or gloves, and many are wearing them barely. There's inconsistency, again, throughout the Department of Corrections. There's no mandate to wear them. And so the inconsistency is permeating across the Department of Corrections. Again, we're going to address that here in a minute. I'm going to show you why none of this will ever be consistent here in a moment. Avoid handshakes. Well, you can avoid handshakes. Both inmates officers and inmates don't shake hands anyways. But there's a different element here, which is that officers must secure inmates. Now, this happens mostly on your higher custody units, your level 4s, level 5s, or your closed and your maximum custody. But it also happens on medium level custodies or any time that there's a security disturbance. A staff member, and I'm going to show you an illustration of that, has to cuff an inmate up. So on any of the higher custody units, the closed and the max custody, or level 4s, level 5s, for any inmate movement out of the cell, they must be secured. And so that means that an officer has to put cuffs and belly chain on the inmate and then escort them by touching them and escort them to wherever they're going to go, medical or school or wherever they're normally going to go. And then they have to uncuff them, or they leave them in cuffs depending on where they're going, and then they bring them back and escort them back, and then take the cuffs off. So there is officer to inmate contact, physical contact, every day of the week. So it's not so much a handshake per se as it is a function of the security protocols within the Department of Correction to have hand-to-person contact with inmates. And then, of course, if any of these security issues pop off or there's any type of disturbance or something like that, of course, there's going to be all of that. But that's not even necessary to transmit this disease, right? All we got to do is just be breathing within somebody, near somebody. Disinfection. Okay. So this is another huge and massive issue, right? The Arizona Department of Corrections does not let inmates have very good cleaning supplies. They're watered down. They met them out in small doses. They have a contract for specific kinds, and they will only get those specific kinds. Inmates can't have bleach. There's supposedly crews that are going around and cleaning with bleach, and that now at the deputy wardens of each unit. But that again is being reported as being very inconsistent. So that's out as well. So none of these preventive measures are possible in the Arizona Department of Corrections. So what does that mean? That means that when you can't prevent it, it's going to take off. That's why everybody that's been in the Department of Corrections or understands how it works is repeatedly screaming to the governor and to the director and to every man, woman, child in the state saying, you cannot possibly let this current status continue in the Department of Corrections, that you have to get people out of there. You have to remove the overcrowding of it, because there is no prevention methods that are effective and efficacious that are going to be available in there. This is the source of that information. So let's look at that even a little bit further. So this is it right here. This is coronavirus. This is what's got the whole world shaken up. And this is a very virulent form of coronavirus, and it transmits on surfaces, it transmits from direct contact, and it transmits through the air, and just from the air we breathe. And that's why we have the 6-foot separation admonition that's coming from the CDC and other places. So as this thing travels through the air, how do you stop it? You can't possibly stop it. And when it travels through the air, it gets on all kinds of surfaces. And so there is no greater threat to the spread of this disease than you will find in prison. It's very difficult to find another place that has the environment and circumstances so perfectly aligned to cause the maximum amount of spread as you will find in a jail or prison, because of proximity, because of lack of cleaning supplies, lack of ability to separate, lack of PPE, and lack of soap, and all those things that we just covered. So it's the perfect storm in there. Moreover, you have staff members that work in these small towns, and they work in these communities. And so and we've discussed this before in previous videos, and it's been out there quite a bit. So you have a staff member who works in a prison. That staff member is out in society. Maybe he's shopping, maybe he or she are shopping, maybe they're out somewhere. We've all been on lockdown. We're trying to flatten the curve. But you still have to go out there. People are getting sick. It's already being reported in prisons. We've had positive from staff and inmates in Winslow, Tucson, Florence, Iman. So it's out there. And the thing about this virus is that you are asymptomatic. You don't show symptoms for anywhere from 7 to 14 days. But that entire time, you are contagious. So you spread the disease for up to 14 days without ever knowing that you were doing it. And so many of these staff members have been out in society, and maybe they picked it up somewhere, they breathed it in somewhere, someone else didn't know that they had it, now they've got it, and they go to work, and they walk into work, and they go into a meeting room like this with a bunch of other staff members, and they have their morning briefing or afternoon briefing or evening briefing, and they get assignments, and they go to their housing assignments or whatever their assignment is for the day, and they start interacting with the inmates, the incarcerated. And so it may not be touching, it may not be a physical contact, but they're certainly going in and breathing and in the air and around the surfaces of this. And this is why the PPE part was so important. Because even if the staff members are being vigilant about not having contact with inmates, which is a pretty normal thing in the Department of Corrections anyways, unless you're on a higher custody yard and you have to do the movement like we discussed before. But at the same time, these staff members who may or may not be infected, are going in and breathing the air that's shared air, recycled shared air, and breathing on surfaces. Now, if you saw in slow motion what it looks like when you breathe and the amount of particles that come out of your mouth every time you take a breath, you'd be astonished how much microscopic material comes out of your body when you breathe, and it goes all over the place. And I'm not just talking about correctional staff, line staff. I'm also talking about nurses, and I'm talking about what they call the white shirts and the gray shirts. The white shirts are kitchen staff, the private contractors that work for the kitchen. I'm talking about gray shirts, which are the maintenance workers. All of these people still have to show up to work. The prison has to run. The administration, the CO3s, all of these people have to be there. They interact with each other and they interact with the inmate population. At the same time, after they go in there, and all they need is just one. Now look at the numbers that we showed earlier in this video about the vast amount of people that are going in and out of these prisons. So we have all these small prisons all strewn across the state, like I've showed you earlier. And we have staff members going in and out of each one of them, like I showed you earlier, the numbers, at the complex level and at the unit level, and multiple units and across multiple shifts. So 2 or 3 times a day, depending on the unit, there is a massive amount of people going in and out of the prison, and they're crossing each other. And they're walking into the place where the last group left. And this cycle continues and repeats and continues and repeats, and we don't have cleaning supplies, and we don't have PPE, and people are electing not to wear PPE, and so all of these things are becoming extant in the Department of Corrections. And then they go out into society. So let's just say that one staff member brought COVID into the Department of Corrections into a particular unit, which we've already seen with positive tests. That gets one inmate sick. Because of those environmental conditions, multiple inmates get sick. That again transmits to the other officers that are working across the multiple shifts because they're breathing that air. They're in that same environment. So now one staff member came in with it. A number of inmates contracted it. The inmates then unknowingly give it back to multiple staff members. Those multiple staff members then return to their small towns, like Safford, like Douglas, like Winslow, like Fort Grant area, like Surprise, Arizona, and all the places where the staff at Florence Complex live, East Mesa, Chandler, all that, Yuma, Kingman. They return to these small communities and they interact with their families, and their families interact with people. And so what's happening here is with no exaggeration whatsoever. So what we've done is we've created this perfect machine, this perfect conveyor belt of staff members contracting the virus, bringing it into the prisons where it's going to explode across the vulnerable prison population, and then that infecting multiple more staff members who don't even know they're sick yet. What happens when a staff member does actually start to be symptomatic after being contagious for 10 or 14 days, once they actually start showing symptoms, they quarantine that staff member. So the job still has to be completed, so they backfill that position that they just quarantined this person for with another staff member. And what happens to that staff member? And then that's a new family. And so what happens now is all of this comes out into these small towns. And this is the real heinous nature of what Governor Ducey and David Shin have failed to take into consideration, is the decimation not only to the inmate population, the decimation not only to the staff that can and will likely occur, but this is going to have a massive effect on these small towns that I've illustrated from all over the state. So this is what I'm trying to tell you, is all these prison towns, these little rural prison towns, how many hospitals did they have? We showed that earlier, right? Most of them have one hospital. These are not giant, well-funded resource hospitals. These are hospitals, little tiny community hospitals. They cannot withstand a massive influx of people coming in that need urgent or intensive care. And so what's going to happen is more people get sick and more staff members get sick and more family members get sick, is that they're going to put a greater and greater demand on these small rural communities. And so what I have been pushing for a couple of weeks now, again, I've been pushing for a number of things, but one of the big things that I've been pushing for is, it turns out when you overlay the map of legislative districts over these areas where the prisons are, it turns out that there's only a handful of lawmakers in the state of Arizona that have prisons in their area. I believe 2 sets have 3, 4, or 5 of the prisons in their rural legislative districts. Some of them are Republicans, some of them are Democrats. Remarkably, what shocked me a little bit was how many of both the Republicans and the Democrats who have prisons in their legislative districts are actually in their respective party leadership. I think the majority and minority whips, the majority and minority leaders from both parties in both houses, maybe missing 1 or 2, have these rural prisons in their districts. It's these people's constituency, these lawmakers' constituency, that are going to be decimated. It's their hospitals that are going to be decimated. It's their community that's going to be decimated when this thing ramps up into full speed, because the economy of these small towns is touch and go as it is. Most of them completely rely on the prison and then the ancillary services to the prisons. Florence is definitely that way. Williams, Kingman, Douglas, Safford, the prisons is a major employer. And so when these people get sick, that's going to have a correlative effect on the economy of these towns. So not only is the healthcare system going to get tested to the point of breaking, but the economy is going to break in these places, because shop owners are going to get sick, and all of this is going to come out to the population. This is the issue that's so important. This is the issue. So what the governor and what the director do is they are gambling. They might as well be in Las Vegas at a table, and they're hoping and wishing and praying and doing voodoo dances and whatever else to just hope beyond hope that what I'm outlining and what a lot of the criminal justice reform movement, what the Arizona Correctional Peace Officers Association leadership is outlining, what's happening at the national and state and municipal level, politicians are outlining, is that this thing doesn't blow up like this. But they've done absolutely everything they can to ensure that it does. They have, as Mr. Garcia said, completely abandoned everybody. And we're talking about Doug Ducey and Director Shin, and to a large part, Arizona Department of Health Services Director Dr. Christ. They've just abandoned everybody and just said, hope it works out. Hope it works out. And so my call is to get the legislators that are in these various prison legislative districts. I'm going to put the list up here now. We want these people to recognize the threat to their legislative districts and to their constituencies, the real and present, clear and present danger to their constituents and constituencies and their economic livelihood in their areas. And we want them to go and talk to Doug Ducey. That would be bipartisan, that would be legislative leadership, and we want them to go talk to Governor Ducey and not accept anything short of real solutions where everybody's at the table. You have literally a governor that is playing craps with the lives of thousands and thousands of incarcerated staff and free citizens around the state, mostly in rural communities. This is the core reason that I've been making this argument for the last couple of weeks, that the only way to reach Doug Ducey is going to be that group of legislators that I just listed. The citizens of Arizona as a state has nothing left of value to Doug Ducey. He came here, he made his fortune in the ice cream business. He's been elected governor, so he's reached the pinnacle of the political establishment here in the state of Arizona. So there's nothing left here that has any value for him. The only thing that would have any value to a guy like Doug Ducey at this point would be to run for national office. And I believe strongly that he is. A lot of the indicators that he has made this second session have been one who wants to run for a national political office. So the voters of Arizona, the mothers, the fathers, the brothers, the sisters, there's no value in them to Doug Ducey. He's going to get Republican votes if he runs for a national office, irrespective of what he does now. The last thing he's going to do is position himself to look weak or soft on crime running into a national election in 2024. So he's not going to let anybody out of prison. He's made that very, very clear that he's not going to do that. He's also not from here. He's a carpetbagger. He's a transplant in Arizona, so he doesn't have any organic, natural love for this state beyond how it serves him. Now, I know that's extremely cynical, but at the end of the day, look at what he has done here. He couldn't be more cynical with the way that he has behaved relative to this outbreak, prisons, the economy, the shutdown, and everything else in between. So when we're talking about Doug Ducey, all the legal pleas, all of the humanitarian pleas, all of the logical pleas, all of them don't mean anything to him. He can resist all of them with no political loss whatsoever. He can't run for governor again. The only group of people in Arizona that has anything that Doug Ducey needs anymore moving forward is that group of legislators that I listed here. Most of them are a majority of both sides of the party. Those are the individuals that set the agenda in the legislature and set the votes and create the votes by whipping them up in their respective parties. He still has to pass 2 more budgets. He still has to pass 2 more years of an agenda. And he's on a truncated legislative session now, so he's going to want something when they go back in before they call sine die. So at the end of the day, the only people in Arizona that can reach Doug Ducey is that group of legislators, the ones that actually have something of value that he wants. Is for this reason that I've been calling for a couple of weeks for the social justice organizations and for others to reach out to that group of legislators, get them to understand and recognize the threat to their homes, towns, economies, and get them to go and ask Doug Ducey to make some moves. He's not going to do it otherwise. It's the only real hope, I believe, that we have to get him to do anything. And quite honestly, it may already be too late.